Medication noncompliance is one of healthcare's biggest secrets, a secret that costs close to $100 billion a year. And those numbers will only increase as the baby boomer population ages. But the cost to the patient reaches well beyond the bottom line. It affects their quality of life and takes a toll on family members who are left to monitor medications and enforce their compliance. MediSure is a simple, effective electronic system that helps ensure medication compliance and avoid under- and overdosing. The MediSure system consists of a compact home unit and proprietary pharmacy-based hardware and software. The software, which contains the patient's medical and pharmaceutical records, easily integrates with existing enterprise systems. The hardware for the pharmacy consists of a medication loader, a standalone PC, and scanner that transmits and receives information from the microchip contained in the medication cassette. This microchip contains all of the patient's dosing information and dosing instructions. When refilling the medication cassette, the pharmacist updates the patient's files in the software program, and that information is transmitted to the microchip. The chip is embedded in the medication cassette, and when the pharmacist locks the case that holds the cassette, medication and instructions, both printed and electronic, are ready to go to the patient's home. The home unit consists of a base and a removable medication cartridge. The base contains the LED screen, scroll buttons, and emergency buttons. The medication cartridge has the capability to store up to 4 dosing times per day for 2 weeks. Each dosing time can hold approximately 6 medications. Refilling the medication cartridge is a quick and easy process. The pharmacist takes all of the pills for one prescription and pours them into the loading tray and then into the slots. This automatically dispenses the medication into the appropriate daily slots and moves the cartridge ahead for the second medication. The pharmacist repeats this procedure until all of the medication is dispensed. Then he replaces the cartridge in the unit, seals it with tamper-resistant tape, and locks the lid. The home unit has a slim, compact design and fits easily on bedside tables. The easy-to-read screen and customized speaker can be programmed to several different languages. The scroll buttons allow family members and healthcare workers to review compliance records, check to see how many doses are left in the unit, and load and unload the medication cartridge. The base unit has a built-in modem that can be programmed to dial out to a predetermined number in the event of an emergency. It also has the capability, through a different output, to interface with nurse call systems in nursing homes and retirement communities. At the designated dosing time, the MediSure unit emits a series of beeps and calls medication, notifying the patient that it's time to take their medication. This alert helps reduce underdosing. The auditory message can be programmed in one of several different languages. After the patient is beeped, the correct dosage is sent to the medication tray. When the patient pulls out the drawer, a sensor alerts the system, and the dosing instructions are given visually on the screen and audibly through the speaker. Finally, the action is recorded by the unit and entered into the compliance records. If the patient does not pick up the medication at the assigned time, the dose is sent to a recovery drawer, and the system continues to alert the patient for a predetermined window of time. If the patient wants to take the dosage within that interval, they push the Get Dose button on the unit. This unlocks the recovery drawer and records the action. Once the time window is up, the dose is withdrawn. By recapturing the dose, MediSure eliminates overdosing. The system records the missed dose, and the screen displays a message informing the patient that they missed their last dose. When the medication cassette is empty, the patient, family member, or healthcare worker uploads their records by simply pushing the load button. Then the patient returns the empty cassette to the pharmacist. Because all of the dosing actions are recorded by the unit, the pharmacist is able to review an accurate and detailed record of the patient's compliance and, along with the physician, make changes in the dosage or frequency based on the patient's actual consumption. A printed record of compliance also allows the pharmacist to share the information, consult with the patient's physician, and make needed adjustments. MediSure is also available for patients in assisted living situations and nursing homes. MediSure NH is identical to the home unit, but it requires nurses and caregivers to use a special key to open the medication tray. The keys are specific to each employee and allow the unit to record who last dispensed the medication, as well as the time and dose dispensed. MediSure NH provides accountability of healthcare workers and dramatically reduces the time it takes to administer the medications. MediSure is a simple and easy-to-use compliance system. The pharmacist transmits the patient's medication and dosing instructions to the microchip on the medication cassette. The unit notifies the patient or healthcare worker of the correct dosing time. Missed doses are recaptured. The MediSure NH provides a record of who dispensed the medication and when. The pharmacist and physician are able to review actual compliance records. Studies show that electronic aids such as MediSure can not only increase compliance, but also decrease patient healthcare costs. Patients require fewer health and emergency services. MediSure is a simple, reliable, and cost-effective solution for the escalating problem of medication noncompliance. Equally important, it helps maintain an independent, active, and healthy lifestyle for senior citizens and chronically ill patients. MediSure, the compliance solution.